Okay, welcome back, everyone. We're going to move now from discussing high blood pressure and high cholesterol, some of the underlying chronic conditions behind many other cardiovascular diseases, to looking at those diseases themselves. So the first one is coronary artery disease, sometimes shorthanded as CAD. And this is the most common form of cardiovascular disease in the United States. This occurs when that plaque that we talked about developing in arteries happens in the arteries directly around the heart and the arteries and blood vessels around the heart. Now, this limits the ability of oxygen-rich blood to get to our heart, which is a muscle and needs oxygen to contract, which of course can be potentially dangerous or lethal. Sometimes people have symptoms. They might experience chest pain, shortness of breath, nausea, but oftentimes people don't. And the first sign or symptom is a heart attack if this leads to one. So this is the most common cardiovascular disease in the United States. It's not a completely preventable condition because there are some of those non-modifiable risk factors like genetics or your biological sex. Men are more likely to develop coronary artery disease, possibly because of higher testosterone levels. But there are some of those modifiable risk factors that we discussed that will make a difference here: managing stress, nutritious foods, and physical movement. So that can, like I mentioned, potentially lead to the development of a heart attack. Now, a heart attack is also called a myocardial infarction. That's the technical name. And it occurs when blood flow and oxygen is severely restricted to the heart. So you may have some coronary artery disease going on and know it or not know it. And then if that blockage becomes too severe and not enough blood and oxygen can get to the heart for it to continue pumping, that's considered a heart attack. Now, these can be survivable, but they're often life-threatening, and they do require immediate medical attention to remedy the situation as quickly as possible. There are signs and symptoms. Some are similar in men and women experience some unique symptoms as well. So individuals might experience chest pain or discomfort or tightness, a shortness of breath, maybe pain or discomfort in the jaw, neck, back, arm, or shoulder that comes on pretty suddenly. And then women in particular might feel nauseous, lightheaded, or extremely tired. These are the symptoms that differ from men's. Again, same risk factors, non-modifiable and modifiable behaviors reduce the risk here. Another common form is peripheral artery disease, PAD, and this is just like coronary artery disease, except for the atherosclerosis is developing in the limbs, often the legs, causing a restriction of oxygen and blood flow to those regions. This makes it more difficult to perform activities of daily living and can lead to swelling in the lower extremities, pain, or difficulty walking or moving around. Cerebrovascular disease, more commonly referred to as stroke, is a damage or interruption of blood flow and oxygen supply to an area of the brain. Now, there are two major types of stroke, ischemic and hemorrhagic. Ischemic is the most common. About 90% of strokes are ischemic. This occurs when there's a blockage that prevents blood from getting to the brain. So we see like a clot or an accumulation of plaque. So the blood flow gets stopped and there's a cutoff of blood and oxygen to the brain, which can be life-threatening in a matter of minutes or cause major long-term complications. We also see hemorrhagic strokes when a blood vessel actually ruptures and blood leaves the blood vessel, leaking out into the brain. These are less common. So, how to spot a stroke? The important thing here is to be fast. There are specific signs and symptoms, and medical intervention in a timely manner is crucial for increasing the chance of survival here. So be fast stands for the things to look out for. Immediate changes in balance, vision, blurry vision, and then facial drooping, arm weakness, or difficult speech. And that facial drooping and arm weakness is on one side of the body. So typically, whatever region of the brain is affected by the stroke, the weakness and drooping will happen on the opposite side of the body. So if you see these symptoms in yourself or in another one, if in yourself and you can, or in someone else, immediately call 911. This is life-threatening, and the speed at which you receive care is crucial. Another form of cardiovascular disease is sudden cardiac arrest. Now, this is an interesting one because it's not considered a chronic lifestyle related condition that is based on the lifestyle factors that someone has engaged in or not. Typically, this is often due to an issue with the electrical rhythm of the heart. And it can cause the heart to suddenly stop beating, sometimes because of exertion. So this can be related to a heart attack and lifestyle conditions, but not always. Sometimes these are just genetic conditions that individuals have and may not even know that they have some sort of heart arrhythmia that predisposes them to this sudden cardiac arrest. And this can occur in even young people. This often occurs in young athletes who haven't been screened for arrhythmias, and they have these pre-existing conditions that they don't otherwise know about. And when they engage in high exertion physical activity, it can lead to sudden cardiac arrest. I think the data is that 1 in 300 young athletes shows some risk factor for this. And some schools in their pre-physical checkups will even check for this, but not all. We also have congestive heart failure. So congestive heart failure is when the actual muscle of your heart becomes thickened and enlarged over time from working too hard against probably high blood pressure or the accumulation of too much plaque. The heart has to work too hard and that muscle becomes thickened, and then it can't stretch and fill with blood to easily pump it back out to the rest of the body. So blood flow gets diminished or limited because of this. This is often caused by hypertension, that chronic pressure on the blood vessels in the heart, long-term alcohol abuse, or other heart valve disorders. And individuals with congestive heart failure might feel tired. They might get some swelling and have kidney dysfunction because that moderates or controls the fluid levels in your body as well. Lastly, we have metabolic syndrome, sometimes referred to as syndrome X, which isn't really a disease itself, but is more a collection of certain biomarkers that indicate you're at risk for developing a whole slew of chronic conditions like heart disease, diabetes, stroke, and other chronic conditions. So what are these risk factors? Typically, individuals have to have 3 out of these 5 indicators to be considered as having metabolic syndrome. So high blood pressure being 130 or 85 or higher, high blood sugar levels, which we'll talk about more in just a minute, over 100 milligrams per deciliter fasting, that's considered pre-diabetes, high cholesterol levels, so LDL over 129, or HDL, that healthy one that we want to be high, under 50 for females and 40 for males, because women naturally have slightly higher HDL levels than men. Triglycerides, which is another measure of fat in the blood, over 150, and triglycerides are heavily changed based on what you've eaten recently. And then lastly, obesity, especially central obesity or adiposity, as measured by a waist circumference of 35 or higher for women and 40 for men. So you see this kind of apple versus pear-shaped body. Pear shape would be holding more weight around the hips, and apple shape would be holding more weight around the stomach. You might sometimes hear that referred to as beer belly. This is more dangerous for health long-term because that central weight, that central adiposity known as visceral fat, causes stress to your visceral organs. So fat is an endocrine tissue. It produces hormones. So those hormones can change the way that your organs function. And also just the fat itself puts pressure on them and can restrict the delivery of blood and oxygen. So major takeaways for cardiovascular disease. Overall, chronic diseases contribute to 7 of our top 10 leading causes of death in the world. The most lethal chronic condition is heart disease, which is why we spent so much time covering all the different ones here. 1 out of every 3 deaths in the US is from cardiovascular disease. There are some factors we can't control, like our age, if we're males who are at higher risk, our ethnicity, or our genetics. Those things are outside of our control, but we can make sure we're moving regularly, choosing nutritious foods, avoiding tobacco, and moderating our alcohol, plus more to come. We're going to have our final wrap-up lecture on the blue zones and the healthy habits for reducing your risk of all chronic diseases and improving your longevity and well-being. And that brings us to the last piece, that prevention is key. These diseases can't be cured with a pill or an injection. Once they're happening, it's really hard to reverse them. So prevention is key. Start now, engaging in these healthy behaviors to reduce your risk of developing cardiovascular disease. See you soon for our dive into other common chronic conditions.